move along. But we're going to keep Jemilah here. And we're going to acknowledge her leadership in this exciting development. We're going to invite Asma Ismail to join us on the stage, and Puan Hazami Habib, who's CEO of the Academy of Sciences as well. Both completely critical to this action plan. Please join us. Also want to acknowledge that two other people who were very critical to this process and who we're honored to have in the audience with us. In addition, oh, I'm sorry. And then, wait, I'm getting all mixed up. So we have Kang, right? No, and they're joining us remotely. So hopefully they're with us on video. The Honourable Kang is the Minister of Science and Technology and Innovation for Malaysia, so we're hugely honored to have them. And then also Horjia Wei, Senior Analyst from the Academy of Sciences, I believe is in our audience and was very integrally involved. So anyway, we're super, super excited to hear more about this big announcement.
Thank you very much, Sam. Now, I won't take much time, but it just gives me such an honor and privilege to invite a woman that I always say when I grow up I want to be, Emeritus Professor Dr. Asma Ismail, who is not just a brilliant scientist, but was our former Director General for Ministry of Education, Higher Education, but also a former National Science Advisor, and many, many, many other things, right? So the one piece of advice I will give to all of you is if you're passionate and annoying like me, then you need to find somebody who will actually get the work done. And that is Professor Asma in our case. She has not only led the steering committee for the National Planetary Health Action Plan, she has also led the work on the National National Higher Education Blueprint, which will have planetary health being mandatory for all universities in Malaysia. And she told me yesterday that she's also leading now the educational reform for Malaysia, which will then have planetary health from K to 12. So without much further ado, please welcome my hero.
Can I have the slide? Okay.
Do you need help?
Yeah, I'm fine. No, I'm fine. Okay.
Do you want me to work the slides?
No, I'm fine.
Okay.
Right. First of all, I would like to thank Tan Sri Jemilah for the gracious introduction. And also like to thank the organizing committee for inviting us to be able to share our plans to move the whole country on planetary health. This is what we want to share with you, the National Planetary Health Action Plan to move Malaysia as a country towards making the planet a better place. Just to share with you the commitment of the country towards this effort, how we have embedded policies, strategies, action plan to move Malaysia as a whole to make us a better place. I will now share with you the plenary address by the Minister of Science, Technology and Innovation, Honourable Kang. Why is it not showing on my slide? Is okay.
There you go. Yeah. So you can klik sekali lagi. Technology. Okay.
Yeah.
Sound engineers.
This
Is the volume up?
Good day to everyone. It is an honor to join. Excellencies, members of the Planetary Health Alliance, distinguished guests, ladies and gentlemen. A very good day to everyone. It is an honor to join this important gathering virtually and to reaffirm Malaysia's commitment and vision to advancing planetary health for a sustainable and resilient future. At the Ministry of Science, Technology and Innovation, MOSTI, we believe that science, technology and innovation are the driving force in addressing the planetary health crisis. Just as STI powered Malaysia's rapid growth, it must now be at the forefront in tackling climate change, biodiversity loss, pollution and emerging health risks. This is why MOSTI is prioritizing 5 focus areas aligned with planetary health. Hydrogen as a cornerstone of clean energy and the low carbon transition. Artificial intelligence for smarter data-driven decisions. Biotechnology to protect health, biodiversity and food security. Aerospace and satellite technologies to track climate risks and natural resources in real time. Last but not least, a vibrant startup ecosystem to accelerate green innovation. Indeed, advances in genomics, geospatial mapping, AI, and green technologies are already transforming how we monitor ecosystems, predict disasters, and build resilience. The challenge is not generating knowledge, but applying it systematically, responsibly, and inclusively to serve both people and the planet. From the Nipah outbreak to COVID-19, we have learned that crises can disrupt every sector, the economy, education, and social stability. The question is no longer whether another crisis will come, but whether we are prepared with the right science, technology, and innovation in place. Distinguished guests, ladies and gentlemen, guided by this conviction, our National Science Council, NSC, chaired by the Prime Minister, decided right after COVID-19 in 2021 for MOSTI, in collaboration with the Academy of Sciences Malaysia, ASM, to develop the National Planetary Health Action Plan. This blueprint, grounded in years of evidence, is designed to balance human well-being, environmental sustainability, and economic resilience. The plan positions Malaysia to harness STI's full potential by integrating green technologies, biodiversity, and genomic databases, advanced data systems, and innovative governance models. It ensures that our research solutions are sustainable, science-driven, and future-ready. Anchored on 6 key result areas and 5 systemic shifts, the plan redefines progress beyond return on investment (ROI) to also embrace return on values, healthier people, stronger community, greener ecosystem, and long-term resilience. Under the 13th Malaysia Plan 2026 to 2030, we are embedding planetary health principles into development priorities, strengthening environmental governance, building climate resilience infrastructure, and safeguarding biodiversity. Complementary policies such as the Malaysia Blue Economy Blueprint and the National Education Reform further align our economic and education systems with planetary health goals. Distinguished guests, ladies and gentlemen, we know this is not a journey Malaysia can take alone. Planetary health transcends borders. It demands collaboration, shared responsibility, and knowledge exchange. That is why Malaysia actively engages with global partners, including the Planetary Health Alliance, to co-create solutions and mobilize collective action. On behalf of Malaysia, I thank the organizers of the Planetary Health Annual Meeting 2025 for recognizing our efforts. This honor strengthens our resolve to stand with the global community in safeguarding the health of both people and planet. Let us act with courage, responsibility, and unity for a healthy planet, healthy people, and a prosperous future. I wish all of you a successful annual meeting ahead. I now invite the chairperson of the NPHAP to elaborate further on the action plan. Thank you.
I will now deep dive into the plan. Basically, what the front cover is showing to you is a near extinct plant called the begonia species, right? And it's side by side with the most advanced in terms of development, which is Kuala Lumpur. The question is, how do we balance between a clean environment, but at the same time, progressive city? Because Malaysia is at a turning point. We have, if you look at the progress across the sustainable development pillars from 2000 to 2019, Malaysia experienced steady economic growth. So basically, just pay attention to the blue line. And you see that we have now faced from 2000 to 2019 a very progressive economic growth. But from 2000 to 2010, STI seem to be plateaued. We seem to be stagnant in using STI to move our solutions. And we find that by looking at this, we now see that our economic progress is at the expense of environmental development and at the expense of social development. And if we look at our Malaysian Environmental Performance Index, from 2012 to 2022, we have gone from number 25 to now number 130. We are at a turning point. It does call for action to take place. And basically, what is the cost of doing nothing? We ask that question, right? But the cost is going to be expensive for us because by 2019, premature deaths linked to environmental issues cost Malaysia USD 15.86 billion, which is about 5% of our GDP. And between 2005 to 2022, these costs now have grown to now 161%. So at the Academy of Sciences Malaysia, we say that we have examined this post-COVID, and we then say, okay, the combination of academic science 4 papers on precision biodiversity, on climate change, on Science Outlook 2020, and on zoonosis revealed critical insights into outbreak risks and impacts, underscoring the need now for a forward-looking action. So in response, the proposal, that's how we got together and said, okay, the country needs to have a proposal for a national planetary health action plan that was tabled at the National Science Council, chaired by the Prime Minister on the 4th of April, 2022. The National Science Council then mandated MOSTI, which is the Ministry of Science, Technology and Innovation, through Academy of Sciences Malaysia to actually lead the development of the action plan, but this time around, grounded in science, technology and innovation with, of course, never working in silo, but working now with central agencies and key ministries. This is the plan. This is the framework that I would like to share with you today. Basically, when we first started this, we say we gotta have what is the grounding principles of doing this. So we then say there are 4 principles that we now hang on to, which is humanity-centric, not human-centric, humanity-centric, STI-enabled, nature-based, as well as values-internalized. What do we mean by this? Basically, when we talk about humanity-centric, all right, that is placing people, especially the most vulnerable, at the center of every decision. But when we talk about humanity-centric, it's not about human-centric. When we talk about humanity-centric, we have to now take care that the decision we make now also must be planet-friendly. The next one, to have science, technology, and innovation enabled, meaning to say harnessing STI, levers for resilience and sustainability. Nature-based, valuing ecosystems. It's high time we now value the ecosystems as critical infrastructure for health, security, and well-being. And this time around, values internalized, not just values-based, but values internalized. So that now we can embed the universal spiritual values, the indigenous knowledge, the ethics, the intergenerational justice in all of our policy as well as planning. STI, it must be an enabler, because for these principles to be successful will require strong enablers And STI now stands at the forefront, linking human health, ecological systems, and driving faster, more sustainable progress across the 5 areas. These are the 5 areas we are going to use STI. Number 1 is, of course, for data and monitoring, improving prediction, because with artificial intelligence, we can now predict. So improving prediction, evidence-based decision-making through advanced data systems and AI. We are also using this for technological innovation so that we can scale up nature-based and green technologies, because this is where we want to go forward, that advanced startups and whatnot in green, using green technologies that advance sustainability and health. Interdisciplinary research, this is a must as far as grants from the government is concerned, fostering collaboration across STI, across policies, communities, business, and to co-create holistic solution. Policy and governance, we need to embed STI insights into the national framework to ensure inclusive, transparent, and adaptive governance, and local and global collaboration, building partnerships for knowledge exchange, technology transfer, and capacity building, especially for the vulnerable communities. Now, as you now see, anytime you want to address planetary health problem, like it or not, we will have experts working on environment and health. We will have sustainable food, research and education, energy transition, governance, and for the first time, led by Tan Sri Jemilah, we now have values, culture shift of society, behavioral changes, and communication. If we leave them alone, they will still now be working in silos, because that's what we are used to. And so we say to ourselves, we can't do this anymore. We can no longer work in silo. Because the way to solve planetary health problem is to have interlink, because all of these are interdependent and interlinked. So now how do we now make all of these people, the experts now, to make sure that they are not working in silos? So it's very important that each of the key results areas are not implemented in silo, and they need to be interconnected to ensure coherence and integration. And how do we do this? This is the change that we have now undergone. It's not easy, ladies and gentlemen. I've got 70 people who are experts in their areas, all saying, what is it now you're saying? All right, so basically, they have worked for environment, health, sustainable food, all these pillars, and they have come up with their strategic plans and action plans, right? Now we are saying, hold on, we need to link all of this together so that now it makes sense, because nothing works in silo. So what holds these pillars together now is the 5 systemic shift. That is the new change that we now brought into the plan. And this shift is to, number 1, strengthen governance and management of the nation's natural khazanah. Khazanah here means our natural ecosystem. We gotta respect that. Secondly, to nurture people to lead a healthy, prosperous, and values-driven nation. Third, to have planet-friendly business, effective communication, behavioral and values mindset, and sustainable financing and resource planetary health development initiatives. So all those strategies that we have under the key results are now synthesized, synchronized, and held together by the 5 systemic shifts. And with that, we finally align and come down to 53 strategies and 222 action plan. But to make this thing into operation is not that easy either, because leadership is muy importante. Right? Basically, now we say we need to have a transformation sustainability leadership, because there are many leaders, but they are not naturally trained in sustainability. And therefore, we need to have that. The next one is to have an impact tracking framework regarding what we are doing, so that we now know on the fly what is happening regarding progress. And of course, now to have an environmental genomic database framework. But today, we were all talking about how do you balance between economy as well as planetary health. And that's why we say to move all of this, to bind all of this together, is to not talk about return on ROI, but rather to talk about ROV, return on values. And that's what holds all of this together. So you will be hearing a lot more in the workshop on the 9th, I believe, on return on values, and they might be interested for you to now hear how this is now put into action. And basically, when we talk about this, we are talking now about ROI, the ROV, that will now be a forward-looking measure of success that gives equal weight to environmental stewardship, social cohesion, long-term resilience, and socio-economic growth. And we're concentrating on that, on environment, economic, social, and political. So in short, ladies and gentlemen, the National Planetary Health Action Plan brings all of these 6 areas together into one integrated framework that is held together by the 5 systemic shifts and are unifying all that with written on values and grounded on the 4 foundational principles. And to our knowledge, this plan is the first among ASEAN countries and in the world. So how do you now operationalize it? How do you now monitor it? I guess that will be the next question that is all in your mind. So Malaysia national commitment for healthy planet, healthy me. We do not want to use healthy you, because if you say healthy you, that means if you don't do it, why should I do it? You know, so we say no, healthy me. So basically, healthy planet, healthy me, prosperous Malaysia, and embed planetary health into our daily life and decision making, ensuring that every policy, investment, innovation supports a future where people and planet thrive together towards a sustainable and resilient future. And basically the plan calls for, number 1, you gotta have the governance in place in the country. And that is why we say strengthen governance through a mandated National Sustainability Council, not National SDG Council, not National ESG Council. We put them all together to create a National Sustainability Council chaired by the Prime Minister, so that we can align and enforce national commitments under SDG, ESG frameworks, and planetary health priorities. Secondly, to build intelligence system, including the National Environmental Genomic Database Framework to strengthen environmental and health monitoring. We have already started this, we have piloted this, and this will now be able to send that towards the whole country. The third one, to establish a robust impact tracking framework based on our strategies, our action plan. We have developed KPIs so that now we can hopefully use this impact tracking framework to monitor, to evaluate, and improve the effectiveness of the planetary health initiatives. And lastly, this is a whole nation approach, and we need behavioral change, all right, supported by a transformational sustainability leadership module to actually reshape leadership across public, private, and community sectors. So, again, you might ask the question, what sets the plan apart? Basically, I'm sure as in most countries, each country has their own sustainability policies, while Malaysia has introduced many sustainability policies over the years. But what makes the National Planetary Health different is that it does not stand apart from these policies, it connects and amplifies them. Typically, in the past, strategies were often implemented in silo. We are all guilty of that. All right, because one ministry will take care of biodiversity and it will now implement biodiversity by that ministry. Another ministry takes care of energy and that is the same again, working in silo. Another on health and another on food. But all of these are actually interlinked. And that's what we're trying to now say. The National Planetary Health Action Plan breaks down these silos, aligns actions, and makes sustainability a shared responsibility across the government, the business, the academia, and society. And it, of course, embeds STI at its core, ensuring the plan is not only comprehensive, but the plan must also be systemic and practical and, of course, future-ready. Earlier policies laid the groundwork, but the plan now connects the dot, mobilizes the STI, and hopefully builds the bridge towards a Malaysia that is more resilient, that is more fair and prosperous, but this time around, thriving within planetary boundaries. Well, the next question you might ask was that, well, this is a plan, but does it reach out to the individual? Because if this does not cascade, as what Tan Sri Jemilah had mentioned, as what Sam Ayers had mentioned, if we don't own it, if the whole Malaysian don't own it, it doesn't really work. So basically, the success of this plan will now be depending on effective implementation and on Malaysians truly feeling a sense of ownership over planetary health. But as we all know in the room, planetary health can be a little bit abstract. to the layman, all right? And basically, it can live, when it is abstract, leaving people, because you can't hold the planet in your hand, you know what I'm trying to say? So it can be abstract, and when it does that, it gets people feeling a bit powerless, a bit disconnected, and also wondering, do my small actions really matter? So the solution, therefore, to us is to mainstream planetary health in education from preschool to universities. And I'm glad to announce that this is already part and parcel of the education blueprint, which is starting in 2027, next year, as well as the higher education blueprint to the universities in 2026 as well. So this is now going to be seamless. We're going to move from linear thinking to systemic thinking, starting from next year, from preschool all the way to the universities, because to us, education is key. All right, if we can now turn around this, there's a lot of things that we can now move together. And effective communication. I think the group before was already discussing about effective communication that can make planetary health real as well as relatable. Everyday choices that people make, like reducing food waste, conserving energy and water, planting green plants and leaving that in your office, supporting planet-friendly business, and using public transport may seem small in isolation. But ladies and gentlemen, if you multiply that by 32 million Malaysians, they can shift markets, cut pollution, lower costs, and drive a lasting change. So with that, on behalf of the 70 research experts and analysts that help make this plan into reality, with ideas and suggestions from more than 3,500 scientists, policymakers, civil society, youth, and business, we thank all of you for being here, and we know that we cannot do this alone, so we are in the right room with the right kind of people that breathe the same air and have the same rhythm. So let us now collaborate and make a difference to a healthier planet. With that, thank you very much. You can download using this QR code. You can download, and this is the book. Well, basically, this is executive summary about how we do the plan, and you can read a little bit more about this. We will also leave cards that have the QR code so that you can download the document at the registration. Starting, you can get it from us now, or you can wait until tomorrow, whatever. So you can then download, and we hope to be able to now collaborate with all of you. Thank you so much.
Professor Asmil, I want to give you this plaque in recognition of the extraordinary work of the government of Malaysia. Thank you.
There are a lot of people who are involved in this together. Can we all stand up, please? You share this with me. It's not alone. I cannot do this alone. All of you, please, Mahendran, all the team, please stand up.